today. In today's demo, we are going to demonstrate the electrocardiogram. This procedure allows us nurses to identify disturbances on the patient's cardiac status and monitor the effects of the medication, um, give information about the size of the chamber's heart, and aids in diagnosing complications for myocardial infarction and pericarditis. So this procedure needs to um, have the ECG monitor, the machine, the ECG strip or paper, the electrodes with gel, and of course the gauze pad. We need to identify the review for a patient's medical record for order of ECG, electrocardiogram, assess the cardiac status of the patient, keep the patient away from the electronic electronic conductors, and inspect the patient's chest for the skin irritation and skin breakdown. We need to verify the order now to the patient's medical chart for the electrocardiogram. We need also to gather the equipments needed at patient's bedside to to save time and effort. And we need also to perform hand hygiene by the use of alcohol. Uh, then, of course, we need also to identify the patient by checking the name tag and asking the patient itself. And of course, we also need to close the doors and or curtains and provide for client privacy for him not to be anxious about the procedure, as the procedure will expose half of his body, and explain to the patient that this procedure will uh, is non-invasive, and it will record his cardiac activity, the cardiac status of the cardiac activity of the patient, and the healthcare provider will place 12 lead electrodes on the patient's chest and limbs, of course. And this procedure uh, assure the patient that the procedure will not uh, send send him electronic activity or the electronic current, as this procedure is non-invasive, and assess for the patient, ask the patient for adhesive allergies. Then place the ECG machine at client's bedside or at patient's bedside to save on time and effort to there. Then of course we also need to um, adjust the level of the bed at a comfortable working position, and of course we must not forget to uh, the ECG machine must also be plugged on the power outlet, and the of course the patient must be um, positioned comfortably to prevent tension, and of course we also need to um, promote for client's comfort and expose the patient's arms and legs for us to place the uh, limb electrodes. And of course we must also need to encourage the patient to relax, as this procedure is gonna take 5 minutes at most there. And then after, we will now um, implement the procedure. So now, have uh, place the client at supine position, and we also need to uh, tell the patient to remain comfortably, and of course we must select the appropriate side. If the bed is too narrow, we must if the bed is if the bed is too narrow, we will tuck the hands of the patient on the beneath the buttocks to prevent shivering. And of course, we also need to um, select flat and fleshy positions. Avoid muscular positions where you will place the electrodes. Then after, if, of course, if the patient is hairy, do not shave the hair. Instead, clip the hair, of course. And now that uh, that the patient is already set up, we will apply the lead electrodes onto the limbs. Of course, we need to cleanse the site where we will place the electrodes, expose the areas there. Then after, we will peel the electrodes and place it onto the limbs. For the right limb, uh, for the right arm, the electrode should be the labeled as the red, the color red, and for the right lower limb, the right leg, it will be uh, black, labeled as black. For the left leg, green, and for the left arm should be yellow. Then after uh, we will connect the wires to the lymph electrodes, and we will now expose the patient's chest and cleanse it. Cleanse the area where you will place the electrodes, and of course, uh, the placement of the electrodes is also labeled. For the V1, it will be on the right sternal border of the fourth intercostal space, whereas the V2 will be placed on the left sternal border, fourth intercostal space. For the uh, V4, it will be placed on the midclavicular line on at the it will be placed uh, on the level of the midclavicular line and at the fifth intercostal space, whereas the V3 it will be placed between the V2 and the V4, while the V5 it will be placed onto the anterior axillary line, and for the V6 it will be placed onto the um, mid axillary line. Now, now that the precordial electrodes is now placed at the patient, we will now connect the electrodes. There, we will now clamp the electrodes. There. Then after, of course, if uh, this procedure will be placed on the or the standard speed, it will be 25 millisecond, and the machine must be um, set to full voltage. So now, if necessary, of course, we must if the enter the patient's data onto the machine, and of course we also need to ask the patient to relax for him not to prevent tension, and of course we also not to encourage the patient not to talk, as this will interrupt the procedure. Now press the auto button of the machine, as this will generate the results. The 12 lead electrodes will automatically record um, the cardiac status, there. Then after, of course, we must there. Then after, we will now, of course, if necessary, um, adjust the waveform of the machine onto the extent of the waveform of the machine, and there. Then after, when the machine finishes the recording, it will generate a long strip where you will see the uh, status or the results there. So, and then after this, after when the machine finishes, remove the electrodes onto the client from the client. Remove it and disconnect the electrode wires. Then, now that the procedure is already through, we will adjust the level of the bed to the previous position, lower the bed height, and adjust the patient's head position to be comfortable uh, according to his comfort. And of course, cleanse the site of the where you place the electrodes, and clean the ECG machine, of course, as per protocol of the agency. Uh, Perform hand hygiene, of course, and remove additional PPE, and of course, always sanitize before and after the procedure, as well as the used equipment. And of course, we are now through. We will now um, evaluate for the gathered data, of course, not for the quality of the ECG obtained, and of course, we also need to um, attach the ECG strip onto the patient's medical chart, and uh, note for the name, the date, and the patient's name, the date, and the ECG strip obtained. ECG obtained there. So now we are through. Thank you.